Healthcare reform has been front and center in Washington for years now, but of course, reworking the system has proven to be an incredibly complex undertaking. Well, that topic was in focus again today at the Annual Congressional Democratic retreat in Leesburg, Virginia, and that's where we find Ylan Mui tonight.
Democrats are planning to tackle the cost of prescription drugs and access to care in the coming months, calling it one of their top priorities.
I want to focus so much on health care because that goes right to the kitchen table, financial security of America's working families.
Lawmakers heard from Kaiser Permanente's CEO at the retreat. His message?
Stay focused on the affordability issue, and remember, it's not just one or the other, it's both. It's the affordability of coverage and the affordability of care. That is what the American people are suffering from.
He fielded questions from lawmakers on community health, chronic care management, and how the U.S. system compares to the rest of the world. As for big new proposals like Medicare for all, Tyson said that Congress doesn't need to go that far.
We have commercial, we have Medicare, Medicaid, the ACA, and other programs. I would argue that we have enough in the toolkit already to get to universal coverage.
Republicans have rallied against the idea, criticizing it as government-run health care. Instead, 17 Senate Republicans introduced a bill this week to protect pre-existing conditions.
These are, of course, better campaign slogans than serious solutions to the problems facing Americans. On the personal level, I have found that most people would rather have control over their own health care rather than have the government make those decisions for them.
One thing both parties do agree on is that prescription drug prices need to come down. Initial discussions are already underway between Democrats and the White House. For Nightly Business Report, I'm Ylan Mui in Leesburg, Virginia.